Well, good morning. Thank you for joining us. We're gathered here today on the territory of Treaty 6, and I also want to recognize the Métis people who share a deep connection with this land. I'm David Shepherd. I'm the Alberta NDP's Critic for Health on primary and rural care, and I'm joined here today by our leader, Rachel Notley. Now, I just want to start by saying Rachel, myself, all of our Alberta NDP colleagues are thinking of the children and families impacted by this massive and devastating E. coli outbreak in Calgary. We are hoping for a rapid and full recovery for all those who have been affected. But we're here today because it took the government a full week to show any form of public accountability or transparency on this. A full week where parents of sick kids sat waiting for information, for any sign that their government was taking any action at all. And that is simply unacceptable. We know now that more than 260 people are ill. There are dozens of children in hospital dealing with a great deal of pain, suffering, and fear. This is a serious issue that requires serious leadership from our government. But instead, what we got today was a series of non-answers and responses asking the public for more patience. And on top of that, compounding the public's fear and obvious complete lack of leadership on this from the government are new reports that came out this morning that show there is a pattern, a history of health violations at the kitchen at the center of this outbreak. And for more on this, I'll turn things over to Rachel Notley.
Well, thank you very much, David. And let me also say that my heart goes out to all of the victims, the families, and the parents who are so worried about the current and the long-term health of their loved ones as a result of this crisis. Like all Albertans, I was at first horrified to learn of this outbreak, and my thoughts immediately went to the children and the other folks who were impacted, and I just wanted them to get the treatment they needed. And at the same time, it appeared to us to be one of those sort of unavoidable accidents. But now, having today reviewed the series of records from Alberta Health Services that show the inspections at the kitchen that is believed to be the source of this outbreak, well, I believe this tragedy was avoidable. Those records of inspection at Kids U Centennial show that between October 2022 and April of 2023, there were 6 inspections. And every time there was at least one public health violation cited, usually more, and many of them were deemed critical, and in many cases it was the same mistakes being repeated over and over. Failure to engage in basic sanitation requirements, operating without a current food services permit, and failure to clean spaces properly. Let's be clear. This site was a central kitchen for several Calgary childcare centers, and it was found repeatedly not to be handling food properly or safely. And what these 6 inspections show was a clear pattern, in fact, of a failure by the people running this place to keep the children they serve safe. However, what distresses me in some ways even more is that from April 26, which is the last time we saw evidence of this pattern, up until the outbreak being reported just a week ago, no further inspections were held at Kids U Centennial. From what we can tell, inspectors just walked away from this problematic site for almost 5 months. Why? We need answers on this. And why, as David stated, has it taken the UCP government a full week to say anything at all about this crisis? Let me be clear. Our Premier has seriously wounded our system of public health protection in this province. She fired the Chief Medical Officer of Health. Soon after that, the 2 Deputy Chief Medical Officers of Health then left in protest, in part, of this kind of political interference. 10 months later, those positions all remain vacant, the 3 leadership positions in Alberta's public health protection system. Instead, what's happening is it's being run off the side of someone's desk, someone who actually has another full-time job. And I can't help but wonder what factor that has played in all of this. Now, currently, We don't know the source of the outbreak at Kids U Centennial, leaving Albertans to fear that more of them will become sick in the days ahead. And when we do discover the source of that outbreak, we need to move immediately to a full and complete public inquiry into how this food handling site, a site responsible for feeding kids, was left uninspected for months after the pattern that we saw revealed today. None of this is acceptable. Albertans deserve better leadership. And the Albertans in pain and suffering in hospital deserve better leadership. So thank you very much, and I'm happy to take any questions folks might have.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Please state your name and Notley and who you would like to direct your question to. Catherine, your line is open.
Today, whoever wants to answer. So the Chief Medical Officer of Health said that in the last inspection in April, all the issues were resolved, and he said that inspectors are very vigorous with what they do, and so it's extremely rare that any facility has a clean inspection. There's usually at least one violation, maybe not necessarily critical. Why do you see that differently than what he's saying, that this isn't about a pattern, that the facility was in compliance as of April?
Well, I frankly, I just don't buy it. I have a professional history in occupational health and safety and inspections from a long time ago, and I know what this looks like. And when you have somebody go to a site, particularly one like this that is so critically important, one that is in a position of trust to children in multiple places all over the city, you take these things seriously. And when you see a pattern of repeated critical violations, which is exactly what those documents show, you do not walk away from those inspections. So I do not buy what the current part-time acting CMOH is suggesting about this. I'm just not buying what he's selling. And I believe very strongly that the hardworking folks in public health themselves understand that that is not best practice. When you've got a pattern where every time you show up, you're seeing the same problem over and over, you don't stop showing up. And yet that's what happened here. And it's very clear when they did finally go, they found that things had deteriorated in exactly the way you would expect them to when you leave them on their own for over 4 months.
Do you have a follow-up, Catherine?
Yeah, so what needs to change then? Is it that you want to see more frequent inspections? Is it a higher degree of training? Is it more stringent penalties? What are you hoping to see as a result of this?
Well, I think what we need is a systemic review of what happened here. So obviously the most urgent thing we need to do is find out what is the source of the current infection and make sure that's shut down and make sure that children and adults and people who are at risk are protected. So that's the first thing. But this also reveals a systemic problem. And so what we need is an analysis of where it went wrong. As I've said before, the 3 senior positions in Alberta's system of public health protection have been vacant now for almost 10 months. I don't know how that has trickled down with respect to other folks within public health, how many folks are still there, how many vacancies they have, all that kind of stuff. And I don't know what kinds of decisions were taken with respect to and by the leadership. But I worry. In my view, that pattern of 6 inspections in fewer months, where you repeatedly saw critical violations and then suddenly they just stop going to it, I worry that pattern represented an alarm bell with a siren going around saying, this is not ready to be left on its own. And I worry about how many other places have exactly the same kind of alarms ringing right now, where we don't have the capacity for whatever reason to step in and make sure folks are safe. And that is why it is incumbent on the government to acknowledge that the system was not business as usual, and that the system did fail here. And Albertans deserve to know what they are going to do to make sure that there aren't other places where we're seeing that kind of failure.
Thank you, Catherine. We'll go to our next caller. Adam, your line is unmuted. Please state who you'd like to direct your question to.
Yeah, Adam Toy with Global News. Thanks for taking my question. Question for either Ms. Notley or Mr. Shepherd. Just wondering if there was this apparent pattern of repeat health inspection violations, what would you have had happen in an ideal world to these daycare and kitchen operators?
Well, listen, I don't want this to fall into political interference, and I certainly am not an expert in this area. I think the issue of whether orders are written or fines imposed and or work stopped, that is a decision to be taken, I think, by the folks who are there. But what I would say is that I would not have left them for 4 months. I would have insisted on going back to make sure that the mistakes were being corrected. If I had a 6-month or 5-month pattern of mistakes being repeated over and over and over, and hazards being there and critical violations being there, I wouldn't walk away from it. I would develop some type of system that puts a red light or a yellow light on this institution to make sure that it's safe. At the end of the day, it's about making sure that it's safe. And there's nothing about these records that suggest anyone should have been able to convince themselves that it was safe given the preceding 6 months. So that is up to the experts to answer. But the point is that the experts weren't there. And so my question is why weren't they? And what's going on in our system of public health that the experts weren't there?
Thank you, Adam. Do you have a follow-up?
This is maybe, again, a bit of a hypothetical, but so with these E. coli infections, there is a very definite possibility of some long-term effects for some of these children and other people affected. Wondering if you have any thoughts about the state of the healthcare system and whether or not those people are likely to be met by the supports that they need, notwithstanding the great job that, say, the Alberta Children's Hospital has been doing.
Well, I mean, all I can say is I hope very much that everybody is able to get the care that they need. We know our healthcare system is under tremendous stress, but we also know that the hard-working frontline healthcare professionals will do everything they can and do everything they can to keep people, to treat people and to treat them, whether it's emergent or whether it's long-term. My hope goes to them for that. I mean, obviously we can have long conversations about the overall quality of health and what needs to be done to improve it. But right now, in that area of public health, which is about stopping people from getting ill, keeping people safe before they get ill, that's where the alarm bells are going off right now in a very emergent way. That's where we've seen 3 vacancies caused by this provincial government politically interfering, being allowed to stay in place now for 10 months. And we see evidence of a systems-based failure to follow up on what was a risky situation.
Thank you, Adam. We'll go to our next caller. Dean Bennett, your line is open.
Oh, thanks. Hi, Rachel. Hope you can hear me.
Yep.
So the health minister and Mark Joffe pushed back this morning on suggestions that, they haven't been present in the last week. They said that they've been monitoring the situation. They've issued, there's been statements issued, thoughts and prayers have been tweeted. Why is that not enough?
Well, let me say, first of all, I'm talking about 2 different periods here. I mean, we can talk about how effectively they have communicated to the victims of this tragedy over the last week on one hand. I'm here, actually, in some ways, I want to talk about how they weren't present to prevent the tragedy over the last 4 months, because that would be the most important thing. So I want to know why they weren't there for those 4 months. That's my question. In terms of rushing now to ascertain exactly how we got, what caused the infection, I mean, that's very important too, and I hope that they've got everything on it, because folks need to know whether they are at risk of still coming down with this infection or not, because there's a lot of folks who I think are still feeling very fearful. And so we need to make sure that we are giving them absolutely all the information and support that we can.
Do you have a follow-up, Dean?
No, I'm good, thanks.
Okay, we'll go to our next caller. Jason Markusoff, your line is open.
Hi, thanks for taking my question. First of all, sorry I jumped into this late. You were saying there were 3 vacancies. That's 2 deputy CMOHs, and what does this mean that there's these vacancies?
Well, I mean, are you asking me to speculate why they're there, or what the consequences are to the system?
What are they, and what are the consequences of them?
So obviously, Dr. Hinshaw was fired by Danielle Smith soon after she became leader of the UCP, and then soon after that, the 2 deputy medical officers of health who answered directly to Dr. Hinshaw also resigned. And when Dr. Hinshaw was fired, she was replaced by someone who actually already has a full-time job. And that's where we sit. And so 10 months later, we still have 3 vacancies. So why is that? I suspect because well-trained leaders in public health see Alberta as a little radioactive, because our premier has repeatedly articulated rather hostile attitudes towards the science behind public health. In terms of what that does to the system, I'm not inside the public health department, but I would say if your 3 most senior people are, barely there or not there at all, it probably has a lot of negative impacts on how well folks can do their job. And I suspect that the same morale problems that mean that those positions are vacant 10 months later are probably impacting the folks who are still there. And that, it's that system understanding that we are asking this government to look into and take responsibility for and be transparent about. Because public health, it's sort of the poor cousin of our overall healthcare system, but it is fundamentally important to keeping people safe. And we've seen that over and over, and certainly this is an example of that.
I need to correct you on one matter, Ms. Notley. On December 12th, Dr. Joffe actually relinquished his role at AHS. He's no longer there. Just wanted to make sure that people had that information. That was from Alberta Health a few months ago when I was investigating some of the Dina Hinshaw stuff. But this is obviously different from COVID, where Alberta Health was taking the lead. Alberta Health Services is handling the updates with this confined to a single region. They're doing the epidemiological study. Their labs are testing the food products. What is the role for Alberta Health and Dr. Mark Joffe and his office in this that you think they're falling short on?
Well, I think the obligation to ensure that inspections are done, that standards are met, that concerns around systemic problems and what those mean, those fall to public health, and we know that they work very closely with they're part of the ministry, or they're associated with the ministry, and they work very closely with AHS. I think teasing them out is a bit of a complicated exercise, as we saw during COVID as well. But the matter of making sure that people are protected is squarely within the responsibility of the Chief Medical Officer of Health and the deputies that do that work day in and day out.
Thank you, Jason. We'll go to our next caller. Okay, we'll do one more pass for calls then. Just a reminder, if you're on Zoom, it's the raise hand function. Yeah, here. Go ahead. State your name and outlet and who you'd like you to direct your question to, please.
Hi, this is Susan Zielinski at the Red Deer Advocate. I was just hoping we could switch to the crisis in family medicine and what the NDP sees need to be done to address that issue.
Well, I mean, we had a lot of conversation about that during the election, and you know, David has been advocating for a very long time around our plan to expand family health teams, to develop family health clinics, and to engage in a far more robust recruitment effort. So we've been pretty clear that these are the things that need to do. We had proposed a pretty significant investment in terms of supporting family health physicians now in their clinics and helping them have more folks who can help them do their job so that they're able to see more folks and take on new patients, and at the same time expanding the primary care clinic model across the province as much as we can, while again finding ways to recruit more physicians, including ensuring that we get the best value and expertise from foreign-trained physicians who have so much to offer us, and many of whom are not able to fully contribute in Alberta at this time. So we have a pretty, I'm sorry, it's a long and kind of wonky answer, but it's a policy that David spent a lot of time consulting with family physicians and primary health care providers on in advance of the election, and it's one that we were very pleased to roll out to Albertans. And I don't know, did you want to offer anything else, David? Sure.
You know, the situation with family medicine, I think, goes to what Rachel has been speaking about all this morning, and that being a total and utter lack of leadership from the UCP. Let's be clear. This isn't a new thing to them. They were in government for 4 years, and indeed, much of the situation we find ourselves in with the shortage of family physicians was made much worse by their decision to tear up contracts with doctors in the province of Alberta and force through changes that caused the closure of clinics and forced doctors out of practice and out of province. So where we are today, they have been hearing for years from family doctors what they need to do in this province. The previous health minister did an entire process of multiple committees to provide advice. That report has been sitting on Adriana Lagrange's desk since she stepped into the role about 100 days ago. So the Alberta Medical Association and other family physicians that I've spoken with and heard from have been absolutely fundamentally clear. We are in a crisis and we need immediate action from this government. But so far we have seen them dragging their feet, hiding from cameras, and refusing to even come forward with the slightest inkling that they are going to make any change. So really, we need to see real concrete action from this government immediately to address this crisis and make sure that Albertans continue to have access, indeed that far more Albertans will have access to a family doctor in primary care.
Thank you, Susan. Do you have another question?
No, thanks. That's good.
Thank you. Okay, we'll do one quick pass for questions. Just a reminder, if you're on Zoom, it's the raise hand. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.